In this video, we will speak about calcium sensitizer Levosimendan. Currently, Levosimendan is the only drug from the group of calcium sensitizers that are approved for the treatment of heart failure in humans. Another drug from this group, Untitled, is a veterinary medication. Levosimendan is mainly used for the management of acute heart failure or acutely decompensated congestive heart failure. Mechanism of action is based on an increase in the sensitivity of cardiomyocytes to calcium. It increases cardiac contractility. Levosimendan increases myofilament calcium sensitivity by binding to cardiac troponin C in a calcium-dependent manner. Although it increases a myocardial performance, but myocardial oxygen demand substantially doesn't change. Also, this drug doesn't cause a calcium overload in the cardiomyocytes, so it doesn't increase the risk of arrhythmias and calcium-dependent cell injury. But this drug increases the effect of calcium ions in the myofilaments during systole. Diastolic function is not worsened because this drug doesn't significantly influence on the intracellular calcium level during diastole. It even may reserve systolic dysfunction in the case of myocardial stunning and hibernation. Also, it has a vasodilatory effect. It acts as the opener of adenosine triphosphate sensitive potassium channels in the smooth muscles of the vascular wall, resulting in an increase in the intracellular potassium level that leads to the vascular smooth muscle relaxation. Despite the fact that vasodilation leads to a reduction of the preload and afterload, resulting in improvement of hemodynamic, hypotension may appear or become more severe. It's assumed that Levosimendan may open the mitochondrial adenosine triphosphate sensitive potassium channels in cardiomyocytes too, so the drug may have a cardioprotective effect. Also, it's known that Levosimendan acts as a selective phosphodiesterase 3 inhibitor. Phosphodiesterase 3 modulates contraction of the cardiomyocyte and vascular smooth muscle. Its inhibition leads to improved myocardial contractility and vascular smooth muscle relaxation. So, Levosimendan improves myocardial contractility, decreases preload and afterload without a significant increase in the myocardial oxygen demand and arrhythmogenic effect. It should be noted that elimination half-life is approximately 1 hour. 54% of the dose is excreted with urine and 44% of the dose is excreted with feces. In patients with impaired renal function, the excretion is slower. Levosimendan should be used in patients with a severe reduction in the cardiac output resulting in compromised vital organ perfusion. If acute heart failure complicated by hypotension is caused by hypovolemia or any other potentially correctable cause, Levosimendan is not recommended before the correction of such causes. But if beta blockade is considered because of hypoperfusion, Levosimendan is the preferred option even over dopamine and dobutamine to reserve the effect of beta blockade. Monotherapy with Levosimendan is not recommended in patients with systolic blood pressure less than 85 mm mercury or in the cardiogenic shock because of potent vasodilatory effect, but in this case, it can be combined with other inotropes or vasopressors. Unlike Levosimendan, other inotropes with adrenergic activity can cause arrhythmias and deteriorate myocardial ischemia. Levosimendan is used as an intravenous bolus at the dose of 12 micrograms per kilogram over 10 minutes. But such bolus is not recommended in the patients with hypotension. An infusion rate ranges from 0.05 to 0.2 micrograms per kilogram per minute. The usual infusion rate is 0.1 microgram per kilogram per minute. Thank you for watching this video. We hope you enjoyed it. If you want to see more of our videos, please subscribe. and hit the like button.